Today's training is on statin therapy for the prevention and treatment of cardiovascular disease. My name is Tiffany Bridges. The measure description is as follows. Percentage of the following patients at high risk of cardiovascular events age 21 years and older who were prescribed or were on statin therapy during the measurement period. Patients 21 years of age or older who were previously diagnosed with or currently have an active diagnosis of ASCVD, or patients 21 years of age or older who have ever had a fasting or direct low-density lipoprotein cholesterol level greater than or equal to 190 milligrams, or were previously diagnosed with or currently have an active diagnosis of familial or pure hypercholesterolemia, or patients 40 through 75 years of age with a diagnosis of diabetes with a fasting or direct LDL-C level of 70 through 189. The exclusions for statin therapy include patients who have a diagnosis of pregnancy, patients who are breastfeeding, patients who have a diagnosis of rhabdomyolysis, patients with adverse effect allergy or intolerance of statin medication, patients who receive palliative care, patients with an active liver disease or hepatic disease or insufficiency, patients with end-stage renal disease, patients 40 through 75 years of age with diabetes whose most recent fasting or direct LDL-C laboratory results was less than 70 and who are not taking statin therapies. Now we'll learn how to document statin medication inside of an open progress note. When checking for statin therapy with a patient, the first thing we want to do is check to make sure that the patient is taking said medication. Sometimes a patient will see other providers outside of our clinic, meaning the other providers may have prescribed medication that we don't have listed in the patient's chart. The patient may also be taking herbal or over-the-counter medication that's also not listed in their chart. To document this information, we're going to go to current medication, and we're going to ask the patient about every medication that is listed currently in their chart. Then we're going to ask if they're taking any over-the-counter or herbal medication. If so, we'll list it. Then we'll talk about any other medicine that another provider may have prescribed. Let's say, while asking the patient this question, they disclose that they're taking atorvastatin that was prescribed by Dr. Max. Let's go ahead and add that to the system. First, we go to quick search. We type in the name of said medication. We locate it, and it'll pull up an actual schedule of what milligram medicine is being taken. We ask the patient, and they let us know that it's 20 milligrams once a day. We highlight it, and it'll automatically appear on the patient's chart. From there, we're going to go ahead and notate the provider that's actually prescribing the medication, and we know that it's Dr. Maxwell. The next thing we want to make sure we note is that, is the patient currently taking the medication? Did they continue taking the medication? Is it unknown whether or not they're taking the medication, or we know for sure that they are not taking the medication? The only way that this will count towards the UDS report is if the patient is currently taking the medication. And if that's the particular instance, we want to make sure that the letter T is highlighted in blue. Once we reconcile all medications, we're going to click on Verified, and this assures that all medications have been verified with the patient, so when the chart is closed, the medication will carry through, the UDS report will pick it up, and the patient will fall off of the non-compliant list. The verification button has been selected. Now we're going to close out of this particular part of the chart. Okay, and as we can see, the atorvastatin that the patient is taking for lipid therapy is listed on the chart, and it is listed under taking. When the chart is closed, it will fall off of the non-compliant list. Another way to document that a patient has begun statin therapy is for the provider to notate in the chart that the patient is going to start receiving medication for high cholesterol. Although the provider has notated under assessment that the patient has critically high cholesterol levels and they need to start statins ASAP, the information is not being pulled for the UDS from this location. It's actually pulled from treatment. This is where the provider will have the opportunity to actually prescribe the medication via eScript. And from here, the provider can go ahead and start typing in the information and medication that they're wanting to prescribe, how much they're wanting to prescribe, and how many refills that the patient needs. Once this particular act is completed, the provider will be able to lock the chart, and the information will be saved in the patient's chart, which will allow for the patient to fall off of the non-compliant list. Remember, your statin therapy can be located in 2 locations. One, under current medication. It has to be listed as taking, though. The second place will be under treatment, where the provider would have prescribed medication for statin therapy. So for our last and final way of documenting statin therapy compliance, we have our historical data. Now, looking at this particular progress note, we know that it was done on November the 2nd of 2020. We know that the provider acknowledged the fact that the patient does need to be on statin therapy, but they're not going to do anything at this time because the patient's actually receiving care from a provider in Houston at the VA clinic. We know that the medication that's been prescribed is atorvastatin, 40 milligrams once a day. Now, if we go to the left-hand side of the screen, we see that the patient is not currently taking any medication for statin therapy. But this may be an instance of where the MA or the nurse gathered the information and the patient just gave information on medication that they received from our clinic. Please make sure when you're asking patients about medications that they're taking, you do include herbal medications as well as over-the-counter medications and medications they may be receiving from another provider. So to notate this into historical data, we want to go to the patient's hub. And then we want to go to New Telephone Encounter. Under Reason, it's going to be historical data. Next thing we want to do is make sure we change the date. Changing the date is extremely important. November 2nd of 2020. Okay, and we have all the information we need on this side. Then we're going to go to Virtual Visit. We're going to use the slide bar to slide down to current medications. Okay. And now we're going to fill in what it is that we're needing. So we know it was atorvastatin. 40 milligrams once a day. Okay, the new one that we've added is in blue. We know that the patient is taking it. Okay, so now we are going to go ahead, we're going to go ahead and mark the other items that they were taking and verify. Now when we close out of it, there's some medications that have not been set, but right now we're worried about the atorvastatin. Okay, we know that it's now listed on the encounter, so we can go ahead and mark addressed and click OK. This will cause the patient to fall out of the non-compliant bucket and into the compliant bucket. This concludes today's training on statin therapy for the prevention and treatment of cardiovascular disease.